Hi everyone, my name is Prasha Sufal and I'll be presenting the geospatial mapping of otitis media on behalf of the project team. Before we get started, I'd like to acknowledge the traditional owners of the lands across the Northern Territory and pay my respects to elders past, present and emerging. To give you some context, the Northern Territory, which you can see in orange on the map of Australia, is the third largest jurisdiction by landmass, and its population is widely dispersed, with more than half living across remote communities and outstations. On the right of the screen, you'll see an expanded version of the NT map, and the remote communities represented by the dots and the triangles that we visit. Otitis media is an umbrella term to cover a spectrum of diseases involving inflammation of the middle ear. It's one of the most common childhood diseases worldwide, and in Australia it affects about 80% of children by the age of 3, with higher rates in Aboriginal and Torres Strait Islander children. The WHO considers a 4% prevalence rate of chronic suppurative otitis media as a public health emergency, and although in Australia we've made progress to reducing these rates, there has been a decline, but the rate of CSOM in Aboriginal and Torres Strait Islander continues to be at 14%. Otitis media is also strongly related to the social determinants of health. The WHO defines social determinants as the circumstances in which people grow, live, work, and age. And we know that from the Australian Institute of Health and Welfare that otitis media in First Nations children are related to social determinants such as overcrowding, low socioeconomic status, low income, poverty, access to services, hygiene, and education levels. This slide shows the diagnoses we collect in terms of stages of ear disease, as well as the images we capture from our clients. And later, when I show you the map itself, you'll see why we collect all of these diagnoses and how we'll display it on the map. So the project background came to be through the Northern Territory Remote Aboriginal Investment Funding, which the Australian government delivers critical services in remote communities in order to support the delivery of hearing services to close the gap on health inequities. Since we've received the funding, NT Hearing has been able to provide services to over 94 remote communities with close to 2,000 trips, over 12,000 clients seen, and 27,000 ear and hearing checks. So due to this comprehensive database that we've had over the last decade, we decided the use of AI-powered geospatial mapping to identify high-risk areas, overlaid with the social determinant data from the Australian Bureau of Statistics that is known to impact ear disease. So currently the project is in phase 1 and 2, so it's the mapping and geocoding and data linkage to our database of the hearing loss diagnoses and the diagnoses of otitis media, as well as putting the social determinants in. In phase 3, we're going to look at AI tools, and I'll talk a bit about that later on. So this is the map in Power BI. To acknowledge the vastness and the geographic diversity of the NT, as well as to ensure a high level of spatial resolution and granularity, the geocoded community level data was provided by Telstra, which is a national telecommunication network in Australia, and they have precise latitude and longitudinal coordinates for those remote communities. Each geocode also contains metadata on the type of settlement, so whether it's a village, a major town, minor town, or an outstation. It also includes mobile phone coverage availability. Custom seasonal classification for the NT was implemented directly into Power BI using DAX logic, which assigns each service event to a season based on the month and the health service region. Power BI also supports time series layers, allowing users to filter and view seasonal trends over time and across different regions. Time sliders are available. What we're going to do now is go and have a look at one particular community, so you're able to search through those 90 communities. We're going to look at Wadair, which is a larger community in the NT. Now, the data format for the back end of Power BI is an Excel spreadsheet that's exported from a government access database. But ultimately, the aim is to connect Power BI to a SQL server. So what we're going to do now is have a look at this particular community, and we're going to move the time slider from 2008 all the way to 2024. And you'll notice on the screen the data changes. So we've got occasions of service, hearing loss, counts of ear disease, and those diagnoses of otitis media, different types of otitis media. So we're going to go through all the way to 2024. Now this is a manual time series, but you can animate these using some of the AI tools built into Power BI. Once this is done, we will zoom back out and have a look at all of the NT again. So the next steps include adding in the social determinant data for each community, which we'll get from the Australian Bureau of Statistics General Community Profile, and it includes information on dwelling type, education levels, access to services, number of people in a household, and so on. We'll also use the built-in Power BI AI tools like Azure Machine Learning and Cognitive Search. And we'll also look at including external AI algorithms like ARIMA, DBScan, and so on for modeling. We'll have to do that externally and then bring the results into Power BI for visualization. So what are the expected outcomes and the insights we can gain from the map? Well, it's an interactive system that identifies high-risk areas that would guide policymakers and providers in order to provide targeted resource allocation to reduce the disproportionate impact of otitis media. And by linking the social determinant information, we hope to transform service delivery and support those remote communities. By combining AI-powered geospatial mapping with socioeconomic data, this project would aim to improve the health outcomes for these vulnerable populations and highlight the correlation between otitis media prevalence and social determinants. On behalf of the project team, I thank you.